Hi everyone, my name is Maya Pena, and today I will be talking to you all about specific phobias. Just get right into it. Oh, it's like not loading. That's great. Okay, what is a specific phobia? It's an intense, irrational fear of something that possesses little to no actual danger. That usually causes severe anxiety symptoms. It is not uncommon to have a specific phobia. Around 12.5% of the population will meet the criteria for a specific phobia at some point in their life. Development happens in three different ways. One of them is classical conditioning, which involves a stimulus and a response. So let's say I got bit by a dog when I was younger. I could then develop that specific phobia of dogs because my brain is now associating dogs with the pain that I got from that bite. The second is vicarious learning. So let's say, I'll just use the example that I put on the slide. A child who observes his cousin react fearfully to spiders may later express the same fear. It's just kind of visual and like what you saw the other person experience or go through, I guess, and have that fear of. Sorry, I'm blanking. The third is going to be verbal transmission or information. So hearing someone talk about their fears, for example, a snake, and their experience could then cause you to have that same fear. Diagnosis happens first by just realizing that you have a fear, and then if you think that it's a little bit more than a fear, like it's debilitating or like it affects your day-to-day life, you should probably seek a healthcare professional for further guidance. So you want to talk and see what risk factors you might have and ask questions about your system, about your symptoms, sorry. And then also family history can also impact that. And then also you want to talk about why you're avoiding the fear. Here I have a video explaining a little bit more about specific phobias. I've recorded this video a couple of times, and every time I do the link, it only screen records it for like 2 minutes. So I'm gonna give it another try. I'm just gonna pause it really quick, and then we'll see what happens.
16th hole.
Okay.
12.
I wasn't able to get it to start recording without doing the ads first, but here is the video.
Everybody, whether they like to admit it or not, has fears and gets anxious about certain things, whether it be a spider crawling on the ground or getting up in front of large groups of people. In most cases, though, people cope with those fears and confront them. A phobia is the most extreme type of fear, where it actually causes them to go to great lengths to avoid being exposed to the feared or perceived danger, even if there's no actual risk or danger, and people often feel powerless against it. Phobias are considered the most common psychiatric disorder, affecting almost 10% of the population. Phobias are extreme, often unreasonable and irrational fears of something, which could literally be anything, like pyrophobia, fear of fire, electorophobia, fear of chickens, triskaidekaphobia, fear of the number 13, phobophobia, fear of developing phobias, or even pinacophobia, a fear of lists. Unreasonable or irrational fears get in the way of daily routines, work, and relationships because patients with phobias might try to do whatever they can to avoid the anxiety and terrifying feelings associated with the phobia. For example, most people don't necessarily enjoy the company of a spider, but they also don't let it affect their social or daily life. Like, even though I know there are spiders in the woods, I wouldn't avoid a camping trip on account of the spiders. Even if they love camping, somebody with arachnophobia, a fear of spiders, might refuse to go because they know there's a possibility of seeing a spider in close quarters. The fear is clearly interfering with their social life and relationship with friends, meaning it's a phobia. An irrational fear of an object or situation like this is called a specific phobia. The Diagnostic and Statistical Manual for Mental Disorders, edition 5, splits these specific phobias into 5 categories. Fear of animals, like arachnophobia or electorophobia. Fear of the natural environment, like darkness or nyctophobia. Fear of blood and needles.
Okay, I'm just gonna pause it here because from here on it's just kind of different phobias. And then I will go into the therapies and treatments with a slideshow. Okay, so getting back into it, we're going to start with some misconceptions, which are: one, if you have a phobia, you must be crazy. Phobias aren't serious. Just because you might not be afraid of spiders doesn't mean that someone else doesn't have a phobia to it. And then third, phobias are just overrated fears. And then some therapies include exposure therapy and CBT, which is cognitive behavioral therapy. They kind of go hand in hand. CBT does use exposure therapy in it, so meaning they progressively expose a patient to their phobias or their fears, and then with that they use CBT, which just kind of teaches them how to cope with the feelings and anxiety that they get from the fear. And usually when someone does have a specific phobia, it affects their day-to-day life or their relationships with people. So by using these therapies, it kind of just helps ease that and helps them get back to their normal life. And then some alternatives and medications include beta blockers and sedatives. Just to sum it up, beta blockers are drugs that block the stimulating effects of adrenaline, such as increased heart rate and high blood pressure, and just like kind of the symptoms that anxiety causes. And then sedatives help you relax by lowering your anxiety. However, they can become addictive. So if you have a history of alcohol abuse or drug abuse, it will affect just kind of your overall therapy or like treatment, I guess, when it comes to specific phobias, and it can also affect the specific phobia in general. And then here's my works cited page. That is all that I have for you guys today. I'm going to link the video that I briefly showed if you want a little bit more information on specific phobias. And then feel free to ask me any questions or leave me any feedback. Thank you so much. Have a good rest of your day.